Welcome to the Dr. Izzy's Medical Podcast channel.
Question: What is the mechanism of action of nadolol? Answer: non-selective beta-adrenergic antagonism. Question: What is the mechanism of action of napsilin? Answer: inhibition of transpeptidase, thereby inhibiting peptidoglycan cross-linking. Question: What is the mechanism of action of natalizumab in the management of relapse-remitting MS? Answer: binds to alpha-4 integrin on lymphocytes, thereby blocking the trafficking of T cells to the central nervous system. Question: What is the mechanism of action of natalizumab? Answer: binds to and neutralizes alpha-4 subunit of integrin, thereby preventing adhesion of inflammatory cells to the endothelium. Question: What is the mechanism of action of niacin, vitamin B3, as an anti-hyperlipidemic? Answer: inhibits lipolysis at adipose tissue, reduces hepatic VLDL synthesis number 268. Question: What is the mechanism of action of niacin in the TX of hyperlipidemia? Answer: strong inhibition of lipolysis at adipose tissue, increase in ApoA1 levels from HDL. Question: What is the mechanism of action of nitroglycerin? Answer: increases NO and vascular smooth muscle, thereby causing an increase in cGMP and smooth muscle relaxation. Question: What is the mechanism of action of nitroprusside? Answer: increases cGMP in smooth muscle via direct release of NO. Question: What is the mechanism of action of nitrosourea antineoplastics? Answer: cross-linking of DNA, thereby causing DNA damage. Question: What is the mechanism of action of non-depolarizing muscle blockers? Answer: competitive antagonism of the skeletal muscle nicotinic receptor. Question: What is the mechanism of action of non-nucleoside RT inhibitors? Answer: direct binding to RT causing allosteric, non-competitive inhibition. Question: What is the mechanism of action of NSAIDs? Answer: reversible inhibition of cyclooxygenase, thereby blocking prostaglandin synthesis. Question: What is the mechanism of action of nucleotide RT inhibitors? Answer: competitive inhibition of RT causing DNA chain termination. Question: What is the mechanism of action of Nistidine? Answer: binds to ergosterol in the fungal cell membrane and forms a membrane pore, thereby allowing the leakage of electrolytes. Number 766. Question: What is the mechanism of action of Nistidine? Answer: binds to ergosterol, thereby forming polyN-associated pores through fungal cell membranes, thereby creating a leaky membrane. Question: What is the mechanism of action of octreotide in pancreatic adenomas, such as VI-POMA and gastronoma? Answer: agonism at somatostatin receptors at the gastrointestinal tract, thereby inhibiting gastrointestinal secretions. Question: What is the mechanism of action of octreotide in the treatment of acromegaly and gigantism? Answer: agonism at somatostatin (GHIH) receptors at the anterior pituitary, thereby inhibiting growth hormone synthesis and release. Question: What is the mechanism of action of octreotide in the treatment of carcinoid syndrome? Answer: agonism at somatostatin receptors at the gastrointestinal tract, thereby decreasing serotonin release. Question: What is the mechanism of action of octreotide in the treatment of rupture esophageal varices? Answer: constriction of splanchnic, hepatic and renal blood vessels. Question: What is the mechanism of action of olanzapine? Answer: antagonism at 5-HT2A and D2 receptors. Question: What is the mechanism of action of omalizumab? Answer: binds to IgA antibodies, thereby inhibiting their ability to bind to Fc epsilon Re on mast cells. Question: What is the mechanism of action of ondansetron in the treatment of nausea and vomiting? Answer: antagonism of 5-HT3 receptors. Question: What is the mechanism of action of oral contraceptives in the treatment of endometriosis? Answer: induces decidualization and atrophy of endometrial and ectopic endometrial tissue. Question: What is the mechanism of action of oseltamivir? Answer: inhibition of influenza neuraminidase, destruction of influenza hemagglutinin receptors. Question: What is the mechanism of action of oxacillin? Answer: inhibition of transpeptidase, thereby inhibition peptidoglycan cross-linking. Question: What is the mechanism of action of palabisumab? Answer: neutralization and prevention of RSV fusion by binding to A antigen viral protein on the fusion surface of RSV. Question: what is the mechanism of action of Octreotide? Answer: agonism at somatostatin receptors SST1-5, thereby inhibiting adrenocorticotropic hormone release. Question: what is the mechanism of action of pegviscement? Answer: antagonism at GH receptors. Question: what is the mechanism of action of pencyclovir? Answer: competitive inhibition of viral DNA polymerase, does not cause chain termination. Question: what is the mechanism of action of penicillamine? Answer: suppression of T cells and circulating rheumatoid factor. Question: what is the mechanism of action of penicillin? Answer: inhibition of transpeptidase, thereby inhibiting peptidoglycan cross-linking, activation of autolytic enzymes. Question: what is the mechanism of action of perchlorate and thiocyanate in the treatment of hyperthyroidism? Answer: competition with iodide for uptake into thyroid gland follicular cells via the Na-iodide symporter. Question: what is the mechanism of action of pergolide? Answer: partial agonist at central and peripheral D2 receptors. Question: what is the mechanism of action of phenelzine? Answer: non-selective inhibition of MAO-A and MAO-B, thereby yielding increased monoamine levels. Question: what is the mechanism of action of phenobarbital? Answer: binds to GABA-A, increases chloride channel opening, hyperpolarizes neurons and potentiates GABA action. Question: what is the mechanism of action of phenoxybenzamine? Answer: irreversible, non-selective alpha-adrenergic blockade. Question: what is the mechanism of action of phentolamine? Answer: reversible, non-selective alpha-adrenergic blockade. Question: what is the mechanism of action of phenylephrine? Answer: sympathomimetic alpha agonism. Question: what is the mechanism of action of phenytoin? Answer: blocks voltage-gated sodium channels. Question: what is the mechanism of action of phenytoin as an antiarrhythmic? Answer: blocks inactive sodium channels, thereby decreases AP duration. Question: what is the mechanism of action of physostigmine? Answer: inhibition of acetylcholinesterase. Question: what is the mechanism of action of pindalol? Answer: non-selective beta-adrenergic antagonism. Question: what is the mechanism of action of piperacillin? Answer: inhibition of transpeptidase, thereby inhibiting the cross-linking of peptidoglycan. Question: what is the mechanism of action of platelet ADP receptor inhibitors, clopidogrel, ticlopidine, prasugrel, ticagrelor? Answer: inhibition of platelet aggregation by irreversible blocking of ADP receptors, inhibition of fibrinogen binding by preventing GP2B3A from binding to fibrinogen. Question: what is the mechanism of action of Prosocian in the treatment of hypertension? Answer: A1 receptor antagonist, causes vasodilation. Question: what is the mechanism of action of Prosocian? Answer: alpha-1 adrenergic antagonism. Question: what is the mechanism of action of prednisone and prednisolone in the treatment of cancer? Answer: may trigger apoptosis, potentially even on non-dividing cells. Question: what is the mechanism of action of probenecid? Answer: inhibition of the reabsorption of urate at the PCT. Question: what is the mechanism of action of procainamide? Answer: class 1A, blocks active Na channels, thereby increases AP duration, effective refractory period and duration of QT interval. Question: what is the mechanism of action of promethazine, perchloroprazine and thiethylperazine in the treatment of nausea and vomiting? Answer: antagonism of DA and muscarinic receptors. Question: what is the mechanism of action of propafenone as an antiarrhythmic? Answer: class 1C, blocks all morphological forms of the Na channel, thereby significantly prolonging the refractory period at the AV node, minimal effect on AP duration. Question: what is the mechanism of action of propranolol? Answer: non-selective beta-adrenergic antagonism. Question: what is the mechanism of action of propofol? Answer: potentiation of GABA receptors. Question: what is the mechanism of action of propylthiouracil? Answer: inhibition of thyroid peroxidase, inhibition of 5-deiodinase at peripheral tissue. Question: what is the mechanism of action of propylthiouracil in the treatment of hyperthyroidism? Answer: inhibition of 5-deiodinase and peroxidase. Question: what is the mechanism of action of protease inhibitor antiretrovirals? Answer: competitive inhibition of aspartyl protease, thereby preventing proteolytic cleavage of GAG and Pol precursor proteins. Question: what is the mechanism of action of protease inhibitor highly active antiretroviral therapy drugs? Answer: inhibition of HIV-1 protease. Question: what is the mechanism of action of proton pump inhibitors? Answer: irreversible, suicide inhibition of hydrogen potassium ATPase, thereby inhibiting hydrogen secretion into the gastric lumen. Question: what is the mechanism of action of presenamide in tuberculosis therapy? Answer: inhibition of Mycobacterium tuberculosis growth. Question: what is the mechanism of action of pseudoephedrine? Answer: sympathomimetic alpha agonism. Question: what is the mechanism of action of quetiapine? Answer: partial agonism at 5-HT1A receptors, antagonism at 5-HT2A and D2 receptors. Question: what is the mechanism of action of quinidine and antiarenitmic? Answer: Class 1A, blocks active Na channels, thereby increases AP duration, effective refractory period and duration of QT interval. Question: what is the mechanism of action of quinupristin dalfopristin? Answer: inhibition of the 50S subunit. Question: what is the mechanism of action of raloxifene at bone? Answer: estrogen receptor agonist. Question: what is the mechanism of action of raloxifene? Answer: agonist at estrogen receptors at bone, antagonist at estrogen receptors at the uterus. Question: what is the mechanism of action of ramelteon? Answer: agonism at melatonin MT1 and MT2 receptors. Question: what is the mechanism of action of Resagiline? Answer: selective, irreversible inhibition of MAO-B, thereby preventing the oxidation of DA into byproducts and increasing DA levels centrally. Question: what is the mechanism of action of raciltegravir? Answer: inhibition of HIV integrase, thereby inhibiting HIV genome insertion into the host cell genome. Question: what is the mechanism of action of retiplase? Answer: activation conversion of plasminogen to plasmin, which then cleaves thrombin and fibrin clots. Question: what is the mechanism of action of retinoids in treating acne vulgaris? Answer: agonism at RARs and RXRs, thereby decreasing cell growth. Question: what is the mechanism of action of ribavirin in the treatment of hepatitis C virus? Answer: interference with GTP synthesis, thereby inhibiting GTP-dependent 5-capping of viral mRNA. Question: what is the mechanism of action of ribavirin? Answer: inhibition of inosine monophosphate dehydrogenase, thereby inhibiting guanine nucleotide synthesis.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.